would like to welcome all of you in this session on diabetic retinopathy control in Saudi Arabia. The first presentation in this session will be given by Dr. Abdulaziz Al-Rashhi, who will discuss National Prevention of Blindness Committee background information. I just was told by Dr. Saad Hajar that Dr. Abdul Mannan Shodari is not around to give his presentation. In this session, there will be additional presentation which is not included in the program that will be given by Dr. Hassan Al-Dibi at the end of this session about quality assurance of screening program. Dr. Abdulaziz.
Thank you very much. I feel like I want to go down and shake the hands of everyone personally who's still in the room attending the session. I mean, we're very grateful for not breaking our hearts and still taking care of our fields and attending the session. And I hope you really also have strong interest in prevention of blindness, which is supposedly the function of all of us ophthalmologists. I will try to be very brief and go very quickly through the presentation, and the second one will be on the causes of blindness in Saudi Arabia based on the studies that we have, community-based studies that we have done recently with the Ministry of Health and the KSU. So the National Prevention of Blindness Committee was formed because there was an alliance and a partnership between the International Agency for Prevention of Blindness and the World Health Organization in 1999, where they had the Vision 2020, the right to sight. It was an initiative aimed at eliminating the causes of avoidable blindness by the year 2020, which constitute around 75 to 80% of causes of visual impairment. And this global initiative was actually passed as a resolution and approved in WHO, or World Health Organization Assembly, a few years following that meeting. So as a result, the National Prevention of Blindness Committee in Saudi Arabia was established following a royal decree in 1422 or 2001. The decree approved that the Kingdom of Saudi Arabia joins the global initiative, and that His Royal Highness was selected as the chairman of the committee, along with Dr. Abdullah Twergi, who's representing the Ministry of Health, as the vice chair. Myself, I'm the Secretary General, and Dr. Saad Hajar Hiralandi is our national coordinator of Saudi Arabia. In the committee, we have representatives from the Ministry of Health, Ministry of Social Affairs, Ministry of Education, a representative for Saudi universities, private sector, and institutions for the rehabilitation of the visually impaired. The mission of the committee is to formulate, advocate, promote, and support all preventive, curative, and rehabilitative measures towards the control of causes of avoidable blindness and visual impairment in Saudi Arabia, using evidence-based approach, training, health education, and research. Our objective is to support existing programs and activities, create, develop, and establish new programs to combat the causes of visual impairment, provide support to professionals, centers, and researchers who are involved in the same fight against visual impairment, and create a database for eye care and visual impairment programs and resources in Saudi Arabia. We collaborate with the Ministry of Health very strongly through the Non-Communicable Disease Department in planning and executing eye care programs. We facilitate the collaboration between the Ministry of Health and the IAPB and other NGOs or non-governmental organizations in the field of prevention of blindness, and we supervise and encourage the celebration of World Sight Day, as well as represent Saudi Arabia in prevention of blindness activities nationally and internationally with not-for-profit organization or non-governmental organization. So we basically coordinate the activities within the country. We don't have an executive function. We do not ourselves implement any activities except some of the screening programs and some of the general health awareness campaigns. But in terms of service delivery and patient care, this is always mainly given by the Ministry of Health and the rest of the national governmental organizations. Some of our activities that we have done in the past few years, we have the World Sight Day, which is celebrated in the annually on the second Thursday of October of every year, and it's an awareness campaign mainly directed towards the public and also towards the decision makers within the government, whether that is in the Ministry of Health or Ministry of Social Affairs or Education or other agencies within the government. We also participate in shows, TV and radio shows to increase public awareness in terms of the activities that we do on World Sight Day and eye care in general. We strongly work on the advocacy part in terms of promoting the same thing, prevention of blindness among the government and internationally through the Ministry of Health of Saudi Arabia. As you probably have heard over the past few years, Saudi Arabia was behind some of the most important resolutions that came out of the World Health Organization in support of prevention of blindness. Our latest academic, let's say, activity was that we took part in the big international conference for healthy lifestyles and non-communicable diseases in the Arab world and the Middle East that was organized between the Ministry of Health and the World Health Organization. We also, in the coming few weeks, are collaborating along with the Middle East Africa Council of Ophthalmology with the National Guard Hospital and King Saud bin Abdulaziz University for Health Sciences in the Pediatric Ophthalmology and Optometry Symposium, and this will take place at Marriott Hotel on the 17th to the 19th of March of this year in Riyadh. Again, we have another activity that we're doing in collaboration with IBSAR, which is a non-governmental organization whose main function is the rehabilitation of the visually impaired, and it's based in Jeddah, where we will collaborate with them on the low vision rehabilitation course, which will take place from the 18th to 22nd of May in Jeddah. We have done several programs and surveys within the kingdom. We have the Diabetic Retinopathy Control Program, where we developed in collaboration with our partners, the Ministry of Health and King Saud University, a national diabetic retinopathy control program, and we have reviewed the National Action Plan for Prevention of Blindness and Eye Health. We have conducted several RAB studies plus diabetic retinopathy surveys, and we'll go talk about this a little bit in detail in the next presentation, as well as we are finalizing the guidelines to do the National Survey on Blindness and Visual Impairment within Saudi Arabia. The Diabetic Retinopathy Control Committee that we have, it's a subcommittee of the National Prevention of Blindness Committee, is headed by Dr. Ahmed Abu Asrar from the King Saud University, and its main mandate is to develop strategic plan for the control of diabetic retinopathy in the kingdom. As you know, we have a pandemic of diabetes in Saudi Arabia and the GCC countries in general, and it's made up of experts in ophthalmology, public health, epidemiology, representatives of Ministry of Health, tertiary health centers and private centers. Lately, last year, around November last year, we organized a strategic planning workshop for the control of diabetic retinopathy, and that it was a two-day workshop where we had experts from 3 countries, experts who are running and are responsible for diabetic retinopathy screening and treatment programs. And through this workshop, we managed to put screening guidelines and the future screening guidelines for Saudi Arabia in terms of diabetic retinopathy, and now it's in its final stages to be submitted to the Minister of Health for approval and hopefully execution. We've also done the rapid assessment of avoidable blindness surveys, and we added to that diabetic retinopathy because the standard RAB did not contain diabetic retinopathy, and we were one of the first few countries that started the inclusion of diabetic retinopathy into the survey. And these surveys were the first public surveys or community-based surveys that were done in Saudi Arabia over the past 18 years. It was done in collaboration and strong partnership with the Ministry of Health, as well as assistance with the King Saud University, and was led by Dr. Saad Hajar, our national coordinator. It was done in Taif, Jazan, and Ahsa over the past year. This is our website, npbc.org.sa, and we encourage you to please visit the website. We need your support, we need your advices, we need even your assistance, and we need also volunteers because of the programs, the several programs that we have in Saudi. Shall I continue with the next one?
Yeah.
Okay. The next one will be a little bit more specific into what we have found as a result of the 3 surveys that I've just mentioned to you, the RAB surveys that were done in Saudi Arabia over the past year. And as I've told you, these were the first community-based studies that we've done in more than 18 years in the country. And I would like first to start by thanking the team, who many of them had big roles in the implementation and execution of these studies. As we all know, Saudi Arabia is in the top 10 countries with the highest prevalence of diabetes. Diabetic retinopathy is one of the commonest, not commonest, but one of the severe complications of diabetes. Regional data on the current prevalence of diabetic retinopathy and causes of blindness and visual impairment is lacking, as well as many data that we need and are essential for our planning. And without this accurate information, we will never be able to do and to plan properly good and effective screening programs. And this was the incentive for us to start up these RAB studies that are reasonably easy to do and quick. And as we said, we've done it first in Taif region, then we went to Jazan, and then we went to Ahsa. And as I've mentioned to you, we include the diabetic retinopathy for the first time globally. And this methodology, or the RAB study itself, was developed by the International Center for Eye Health in London, which is part of the London School of Hygiene and Tropical Medicine. It is simple, fast, and cost-effective, yet very reliable methodology to give us just a general idea on the causes of visual impairment among the population in a certain area above the age of 50. So the survey provides the following: prevalence of blindness, severe visual impairment, and visual impairment. It also provides the prevalence of blindness and severe visual impairment from cataract, as well as the prevalence of diabetes and the prevalence of any diabetic retinopathy and the sight-threatening type of diabetic retinopathy. It will tell us the main causes of blindness and the prevalence of pseudophakia, those who had cataract surgery already. It will also give us an idea on the cataract surgical coverage, the visual outcome of cataract surgery, and the barriers to getting proper eye care within that region or within the population that we have studied. The design is a cross-sectional population-based study, door-to-door assessment. The target population are persons above 50 years or 50 years and older, residents in the study area. The sample size average was between 2,500 to 3,600 people, and the sampling was a multi-stage cluster random sampling technique with probability proportional to the size. So basically we go in samples, we go into stages into the sampling process. The first stage is selection of clusters, which could be communities and villages. Then we go the second stage within the community or the village, where we go into compact segmenting of selected clusters. So we segment them. Then the third stage is the random selection of 50 people who are 50 years or older, and these are the ones that we examine. And as you see from the picture, we go door to door. We check for visual acuity, external ocular examination, direct fundoscopy, random blood sugar, indirect ophthalmoscopy for all diabetics, and qualitative questions on the outcome of the surgery, the quality of life, and so on. So if we look at the results of the studies that we have done so far, the numbers of people that we have examined in the 3 regions, Jazan was the highest with 3,524, and the lowest, relatively lowest, was Al-Ahsa with 2,692. The prevalence of blindness and severe visual impairment, as you can see from this graph, are in terms of percentage. Prevalence of blindness in Al-Ahsa, for example, was the highest with 6%, 6.2%. Remember, this is in the sample that are 50 or older years of age. So it's not in the whole population, not in the younger generation. And the prevalence of severe visual impairment is 3.8 in Al-Ahsa region. And you can see that in Taif, for example, the percentage was a little bit lower. However, the prevalence of blindness and visual impairment was relatively close. If you look at the causes of blindness, you will see some discrepancy here and changes between the 3 regions that we have visited or tested. The Taif remains the main reason for visual impairment and low vision is cataract. And this you can see it in blue in all the three regions that you can. I don't know if you can see it. I don't seem to have the laser. Okay, yeah. In all the three regions, this is the blue where it indicates the cataract causes. However, you will see differences. For example, in Al-Ahsa region, crisis was in a high percentage, and you can see it in the orange. Sorry. As well as corneal scarring was quite high in Al-Ahsa region, and this is corneal scarring mainly because of because of trachoma complications. If we look at the cataract surgical coverage, we see that the area that had the least quality or the lower quality of cataract surgical coverage was in Al-Ahsa region, where only 84% or close to 85% of the people who needed cataract actually got cataract surgery done. So that would tell us that the need in Al-Ahsa region for cataract services is probably the highest among the three regions that we have studied. If we look at the prevalence of diabetes, again, Al-Ahsa is the highest, with 43% of the population that we have studied had diabetes, compared to almost 23% in Jazan and 30% in Taif. However, if you look at the prevalence of diabetic retinopathy and the prevalence of maculopathy and the prevalence of sight-threatening diabetic retinopathy, here you can see the changes between the regions, although diabetic retinopathy is the highest in Al-Ahsa region, but sight-threatening diabetic retinopathy is relatively lower than what you can see in Taif, for example. 17% or almost 18% of the diabetics with diabetic retinopathy had a sight-threatening diabetic retinopathy cases. So in conclusion, in view of the wide variability of the findings across three regions, it means that these conditions differ across regions, and each region may need its own assessment. And to have a more detailed picture on eye morbidity, especially the posterior segment disease, an extensive national epidemiological study need to be commissioned, which is exactly what we're doing now, the national study or the national survey for causes of visual impairment and blindness in Saudi Arabia. Thank you very much.
Is Dr. Abdel Mannan around? So, if so, we'll move to the next speaker, Dr. Saad Hajar, who will discuss eye health resources related to diabetic retinopathy services.
بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على سيدنا محمد وعلى آله وصحبه وسلم. First of all, we have to thank the organizing committee to give me this chance to present you the eye services facility in Saudi Arabia and related to diabetic retinopathy. As Dr. Abdulaziz, he mentioned first the prevalence of blindness in Saudi Arabia. He already talked about it in his presentation, so I'll skip this slide. And the results also, I'll skip it. And the main causes of blindness, as he already mentioned, that the cataract is the most common cause of blindness. The diabetic retinopathy. Anyway, the diabetic retinopathy differ from this one, from region to region. This is Taif, and this one is Jazan, and this one is Al-Hasa. And we see that it accounts for 10% of causes of blindness in Taif, and 4.5% in Al-Hasa, and 5% in Jazan. Then we'll go to demographic indicators in Saudi Arabia. This one will show us the population, the magnitude of diabetes and diabetic retinopathy in Saudi Arabia. As we know that the total population of Saudi Arabia in the last census was 28.4 million. The population growth rate 3.19% annually. Population below 5 years 11%, and population below 15 years, 31 or 1/3 of the population are young and below 15 years. And we know that our population is a young population, population from 15 to 64 years account for almost 2/3 of the population, and population more than 65 years and above, they account for 2.65% of the population. And we expected the population by 2015 to be 34 million. This slide shows us the population by regions, and this is by health region. It's not by the administrative region, because Ministry of Health has 20 region. So we divided according to the Ministry of Health region. So the highest is Riyadh, which account for 7 million. The second one is Mecca and Jeddah, which account for 5 million. The third one is Eastern Province, which is with Al-Hassa, it's almost 4 million. Then when we talk about a number of ophthalmologists, because we know that ophthalmologists, they are the one who's going to tackle the causes of blindness and the diabetic retinopathy.